Guys, so good morning. Today we will continue with the radiology club with Dr. Vana. She will present the radiology signs. She can start.
Good morning. Today we will talk about four radiological signs. We start from the chest. Anyone know the sign? Yes, signage.
Sorry? Okay, so what's the sign? Anybody has any idea? Okay, what do you see? Describe. Okay, can you help
So
me?
here we see a patient with extensive subcutaneous emphysema. The sign is Ginkgo leaf sign. In this patient, there is extensive subcutaneous emphysema.
This.
Yes.
You can see the subcutaneous emphysema. Just point at them with the pointer,
okay.
please. Okay, pointer. Okay.
This and this.
You can see this
all these.
in the skin.
These are fibers of pectoralis major muscle in which in severe extensive subcutaneous emphysema the fibers will appear similar to the veins of Ginkgo leaf.
Ginkgo leaf sign also can we see her
In the
spinal
spine.
angioma.
Yes.
Spinal
Angioma.
Yes.
angioma.
This is about the chest.
Nice.
This was the first.
So you can see the fibers of the
Fibers of pectoralis major.
radiating
We saw the same case with you, Dr. Ahmed.
Good.
The second sign, this was the Ginkgo leaf sign. The second sign is
So first of all, what do you see here?
Osteolytic lesion
Okay.
within between the anterior and mid two-thirds of the calcaneus, containing small dense calcification.
So what do you think?
Intraosseous lipoma, but I don't know the sign.
yes, intraosseous lipoma.
And what's the sign?
The sign is Cockade sign. Cockade sign is seen in a patient with intraosseous lipoma, in which there will be a well-defined osteolytic lesion with a central calcification resembling the Cockade.
Cockade. What's the
Cockade
cockade?
هم يعني مثل علامة دا يحطون إياها هنا على هذا الهات.
So, مثل القراصة.
The third sign, here this is the normal and this is the sign. So we see anterior bowing of posterior maxillary antrum
Okay.
by a soft tissue density mass. So the sign is Holman Miller sign, or also called antral sign. This is seen in juvenile nasopharyngeal angiofibroma. Refers to anterior bowing of posterior wall of maxillary antrum. Can be seen on the lateral skull X-ray and clearly seen on the cross-sectional imaging.
So,
Holman Miller sign, also known as antral sign.
Antral sign.
This is non-specific finding for angiofibroma, can be also seen in a patient with slow-growing masses, but when there is erosion of pterygoid lamina, this at this time it will be pathognomonic for juvenile nasopharyngeal angiofibroma.
So, what are the other things that can help you deciding this is a juvenile angiofibroma?
The patient should be male,
Must be.
must be male. Usually adolescent, teenage, usually present with epistaxis,
Recurrent, severe,
epistaxis.
okay, and high clinical. Radiological,
Radiological
you have the Holman Miller sign first, second,
يعني
location, the cerebropalatine fossa, and
سايبين
highly
highly
vascular,
vascular
marked
marked
contrast and
vascular.
enhancement. Okay.
The last sign is
This sign we commonly see it a lot of
Commonly,
time. What?
yes, it's wall
Yeah.
echo sign.
Oh, because
Here, this is seen in patient with multiple small gallstones or a large gallstone. Here we see three lines, wall echo sign. We see three lines. First echogenic line representing the wall of the gallbladder. Usually there is a small amount of bile trapped between the echogenic wall and echogenic calculi or the echo, and posteriorly we see the shadow of the stone. So wall echo shadow sign. In another patient, the wall, a small amount of the bile and gallstone and the shadow. The small amount of the bile is important, as we see in the to differentiate it from the other differential. The differentials are air-filled loop of bowel, which may be in this case it may be missed, the sign. Porcelain gallbladder, and there will be calcification of the wall of the gallbladder.
you have to differentiate from porcelain
So
and gallbladder.
porcelain, this can be differentiated. The small lucent layer of the bile usually not present in the porcelain gallbladder.
Yeah.
There will be only calcification of the wall. As we see in this patient, there is calcification in the wall of gallbladder. On the plain film, we see the calcification of the wall clearly. Another differential is emphysematous cholecystitis. So here we see dirty shadow within the wall representing air.
Most commonly, you see this appearance other than gallbladder is a duodenum containing air.
Mm.
And you
Yes,
have to be careful
yes.
with that. Just look carefully, differentiate, is there another gallbladder or not?
Yes, yes.
And be careful, did the patient did cholecystectomy before or not? A lot of times the patient already did cholecystectomy, there's no gallbladder to begin with. And you are happy, I have a gallbladder filled with stones, the patient removed it long time ago. So just be careful with that, okay?
Thank you.
Very, very nice. Thank you very much. I like it a lot. Any questions, any comments? Okay. Yeah, thank you very much.
Thank you.